Quick-fire questions.
If you're suffering with memory symptoms that affect what you're doing and having consequences on your day-to-day activity, then one should definitely get that checked out. If other people mention to you that they're worried about your memory, then you should get that checked out. Even if you're uncertain, there's no harm in getting it checked out, as we'll be looking for risk factors to prevent any issues in the future. Race does have an impact. Some communities are less likely to come forward with memory problems, and diagnosis rate can differ. Vascular risk factors, for instance, these are risk factors for circulatory change, which is a risk factor for dementia, can vary between different communities. There are things we can do to improve brain health. We can assess the various risk factors, and we can lower your risk of disease in the future. And we can do that, according to Alzheimer's Research UK, in 98% of people. So I would stress the importance of having a brain health assessment. Yes, it's very important to keep the brain healthy. We do know that people who have occupations where you have to use the brain more, stress the brain, learn lots of facts, we know that the risk of dementia and Alzheimer's is lower. If you keep your brain active, what you do is you give yourself what we refer to as cognitive reserve. When you learn things, when you take up a hobby, learn a new language, you open up more connections. These are all thought to have positive effects on brain health. So it is important to keep the brain active